As people grow older, many begin to notice subtle changes in their bodies. Energy levels are not what they used to be. Blood sugar becomes harder to control. Blood pressure slowly rises, and persistent aches or stiffness seem to appear without warning. For many adults over 60, these changes often feel like an unavoidable part of aging. Yet researchers today believe there may be deeper biological processes happening beneath the surface. Processes linked to chronic inflammation, oxidative stress, and declining metabolic function. This is one reason why black seed oil, a natural oil extracted from the seeds of the Nigella sativa plant, has gained growing attention in recent years. For centuries, Nigella sativa has been used throughout the Middle East, North Africa, and South Asia as a traditional remedy to support overall wellness and resilience. But modern scientific interest in black seed oil is focused largely on one powerful compound inside it called thymoquinone. Researchers believe this compound is responsible for many of the oil's antioxidant and anti-inflammatory effects, particularly in aging adults. One of the biggest concerns after age 60 is type 2 diabetes. Even people who follow careful diets and take medication consistently often find that blood sugar becomes increasingly difficult to manage over time. A major reason is insulin resistance. The body may still produce insulin, but the cells no longer respond efficiently to it, causing glucose to remain in the bloodstream longer than it should. This is where black seed oil has attracted scientific interest. Studies suggest that thymoquinone may help improve insulin sensitivity, allowing cells to respond more effectively to insulin again. Researchers believe it may activate the AMPK pathway, often described as a metabolic switch that helps muscle and liver cells absorb glucose more efficiently from the blood. Rather than only temporarily lowering blood sugar, black seed oil may help support some of the root mechanisms behind insulin resistance itself. Clinical trials have shown promising results. People who used black seed oil consistently for several weeks often experienced reductions in fasting blood sugar and improvements in HbA1c, a marker that reflects average blood sugar levels over several months. These improvements are not immediate, but over time they may help older adults feel less fatigued, maintain steadier energy levels, and reduce the risk of long-term complications associated with diabetes. At the same time, many older adults also struggle with high blood pressure. As people age, blood vessels naturally become stiffer and less elastic, increasing pressure inside the circulatory system. Researchers believe thymoquinone may also support cardiovascular health through its effects on the ACE enzyme, the same pathway targeted by many common blood pressure medications known as ACE inhibitors. Through its antioxidant activity, thymoquinone may help reduce excessive ACE activity, allowing blood vessels to relax more effectively and blood to circulate more smoothly. Some clinical studies found that individuals who consumed black seed oil regularly for about 8 weeks experienced measurable improvements in both systolic and diastolic blood pressure. While the changes were modest, even small reductions in blood pressure can significantly lower the risk of stroke and cardiovascular disease later in life. Another important piece of the puzzle is chronic inflammation. Many adults over 60 experience constant fatigue, joint stiffness, body aches, or mental fog without fully understanding why. Researchers now describe part of this process as inflammaging, chronic low-grade inflammation that quietly continues inside the body as people age. Unlike short-term inflammation caused by injury or infection, inflammaging develops slowly over many years. The immune system no longer shuts down inflammatory responses as effectively as it once did, causing the body to continuously produce inflammatory substances even when no immediate danger exists. Over time, this ongoing inflammation may contribute to conditions such as diabetes, cardiovascular disease, arthritis, and cognitive decline. Thymoquinone appears especially important here because studies suggest it may help suppress NF-κB, often referred to as the body's master switch for inflammation. When NF-κB remains overactive for long periods, the body continues generating inflammatory chemicals that may worsen fatigue, pain, and tissue damage. Researchers have also observed reductions in inflammatory markers such as CRP, IL-6, and TNF-alpha among some people using black seed oil consistently. What makes this particularly interesting is that blood sugar problems and chronic inflammation are deeply connected. High blood sugar itself increases oxidative stress and inflammatory activity, while chronic inflammation further worsens insulin resistance. Together, they create a vicious cycle that becomes harder to escape with age. Black seed oil may help interrupt multiple parts of this cycle simultaneously by supporting insulin sensitivity, reducing oxidative stress, and calming inflammatory responses at the same time. Still, experts emphasize that black seed oil is not a miracle cure. It should never replace prescribed medication or professional medical care. Instead, it may serve as a supportive tool alongside healthy eating, regular physical activity, proper sleep, and consistent treatment plans guided by a doctor. Researchers also note that how black seed oil is used matters greatly. Most clinical studies use cold-pressed black seed oil because this method helps preserve thymoquinone, the oil's most important active compound. Products labeled unrefined or virgin are often preferred because they undergo less processing. Many studies use approximately 1 teaspoon, or about 5 milliliters daily, while capsule doses commonly range between 1,000 milligrams and 3,000 milligrams per day. Consistency appears to be one of the most important factors. Most studies show that noticeable improvements usually begin after 8 to 12 weeks of regular use, rather than immediately. Because chronic inflammation and metabolic dysfunction develop gradually over decades, the body often requires time to respond and recover slowly. For many adults over 60, black seed oil may not offer dramatic overnight changes, but it may provide something equally valuable: gentle, gradual support for the body's natural systems as they age. When combined with healthy lifestyle habits and proper medical guidance, it may help older adults maintain better energy, steadier blood sugar, healthier circulation, and an improved quality of life over time.